came across a lot of patients, especially patients with a lot of debilitating spine issues, pain, who were in a lot of pain. And these were patients who were sort of on the borderline in terms of their financial abilities. They could afford a little bit, but they could not afford what a spine surgery would cost in a corporate hospital. At the same time, they were approaching the government hospitals and the subsidized public sector healthcare facilities, but there the dates were not easy to get because there was a long waiting line. So I thought, is that something? Gautam and I sort of brainstormed for some time, and we thought, is that a bridge, a gap that we can help to bridge with the funds that he raises? So it started off with a small idea like that. And then in 2013, Gautam rode the Tour of Nilgiris in December, and he raised, I think, close to about a lakh of rupees. And that's how GivingBack started.
Be as fit as you can. I mean, not all injuries are a result of lack of fitness. But for example, my first shoulder surgery, I felt that if I wasn't as heavy as I was at that time, my shoulder may not have popped. And that was a trigger for me to start losing weight and getting fit. I was about 107 kilos at that time. I dropped down to 77, losing a full 30 kilos from then. So that was the first trigger to strengthen, stay strong and stay fit, which will prevent injury to a great extent. Despite all of that, injury can happen. For example, my spine injury subsequently was nothing to do with a lack of fitness. It was a genetic issue aggravated by sport. Now, too bad. When that happens, I think important is to have a positive attitude towards it. You can start feeling sorry and bad for yourself. Oh no, I'm going to be in recovery for a year. But the positive is you can still get back to playing with the right approach and physio and strengthening and all of that. So I think a positive attitude goes a long way in getting you out.
The plan is to get them back or put them back to where they came from or what they were actually doing.
Right.
Rather than them quitting their job or not doing anything at all after surgery.
Right.
So those days are gone. People used to believe that once you get a back surgery or a spine surgery done, you can't get back to your regular work or you can't get back to your previous work. Today, more than 95% good results are there in discectomies. So we are able to actually put them back to where they started out from.
I am Vaiki Venki and this is the Working Athlete Podcast. Here I talk to working athletes from all walks of life and experts from various sports to provide you with inspiration, training tips, time management and lifestyle advice. If this is something that interests you, please make sure you subscribe to the channel so that you don't miss any future episodes. This is a special episode about charitable cause called GivingBack that Dr. Arvind Bhateja runs. Through GivingBack, Dr. Arvind raises funds to provide free or subsidized spine surgeries for those who cannot afford the cost. Over the years, the GivingBack program has supported over 400 people. GivingBack's motto is to help people get back in the game and lead a normal life. In this episode, we talk to Dr. Arvind Bhateja about the GivingBack program and its work over the years. We also talked to a spine surgeon, Dr. Ragavendra, who has been working with Dr. Arvind over the last 10 years about how spine surgery has evolved over the years with the emerging technology. We also talked to one of the patients who has undergone a spine surgery and is now able to go about his life without any issues. Mr. Bishen, who is an avid sportsman who loves playing cricket, badminton, and loves to run, needed a spine surgery after he got injured while playing cricket. He shares about his experience of how after the surgery he was able to get back in the game and is now able to play all the sports and started to run again. With that, let us get into the episode. Welcome to the Working Athlete Podcast, Dr. Arvind.
Thank you. It's my second time here, I think.
You are the very first guest of this podcast. So it is great to be doing this again with you.
It's a special moment for both of us, I think.
Now in person.
Yeah.
Our first one was on Zoom.
That's right.
Back in October, August, we recorded in August 2020.
Yeah.
And it's been now about 75 odd episodes
Amazing.
later.
What a journey
we
that's
are
been.
Here. You just came out of your OT,
That's
Operation
right.
Theatre,
Yeah.
doing what you do, saving lives after a spine surgery.
That's
We
right.
are sitting here and going to talk about the journey with the Giving Back program and all that, right? So, Doc, let's talk about when did this, what was the origin of the Giving Back program?
So I was associated with the Sita Bhateja Specialty Hospital since 2007, which was started by my parents in 1968. And that is a trust. And then when I started in 2007, we started doing brain surgeries, neurosurgery, spine surgery. And for many years, we evolved into that space. And somewhere in the year 2013, when we had already partnered with Tour of Nilgiris to be their medical partners, the organizers of Tour of Nilgiris came to me saying that you can sponsor one rider from your organization or your circle of friends, and we'll let them ride the tour free of cost because you're providing medical support for the 8 days of the Tour of Nilgiris. So at that time, our very good friend and teammate Gautam Raja said he would like to do the tour, and it so coincidentally, fortuitously happened that Gautam was born in the same hospital.
Right.
So he came up with the idea that he would like to do something as a charity rider, raise funds for a cause, right, within the framework of what Sita Bhateja Hospital was doing. And in that 5 years or 6 years that I was in practice at Sita Bhateja, I came across a lot of patients, especially patients with a lot of debilitating spine issues, pain, who were in a lot of pain. And these were patients who were sort of on the borderline in terms of their financial abilities. They could afford a little bit, but not a whole lot. So clearly they were not really ill affording, but they could not afford what a spine surgery would cost in a corporate hospital. At the same time, they were approaching the government hospitals and the subsidized public sector healthcare facilities, but there the dates were not easy to get because there was a long waiting line. So I thought, is that something? Gautam and I sort of brainstormed for some time, and we thought, is that a bridge, a gap that we can help to bridge with the funds that he raises? So it started off with a small idea like that. And then in 2013, Gautam rode the Tour of Nilgiris in December, and he raised, I think, close to about a lakh of rupees. And that's how Giving Back started.
Awesome. So Giving Back has a very, very, cycling background as such.
Absolutely.
Oh, that is great to know. And now, over the years, from 2013 to now, it's been a journey of 9 years for the program itself.
8.5 years.
8.5 years.
And we've done close to 400 surgeries through the program.
Wow.
Over the years, various other friends have ridden the Tour of Nilgiris, including Murthy from Team Spectrum, Shankar, Dipankar. My brother Vivek rode it twice.
Right.
I rode it once.
Yeah.
And we all raised funds for the program. And I think overall we have raised close to a total of about 30 lakhs in the last 8.5 years. And we've been able to fund close to 400 surgeries through that.
Wow. That is a very, very huge number of people benefiting from
Absolutely.
something like this. That, when I look at spine surgeries, right, that is it is not something that is going to happen in ordinary circumstances.
Correct.
People are, if people are really disabled, or they are not able to go about their lives in a normal way.
Correct.
And the Dr. Ragavendra was mentioning that you would do a lot of other things that don't require surgery before
Correct.
only if the other stuff that doesn't work, you
Yeah.
would go and
So
prescribe
in medical
surgery.
parlance, we call that if you fail conservative treatment.
Conservative treatment. That's
Right.
the word that he
Yeah.
used.
So if you fail
Right.
conservative treatment and your disabilities are still persisting in spite of the best trial of conservative treatment, that is when we would advise surgery in most situations. But there's also one situation where you see a patient in the hospital for the first time and you know straight away that they require surgery.
Right, right. So, over the years, you were able to help through this Giving Back program about 400 people. That is a great number.
Close to 400.
Close to 400 people. And so, what is the kind of road ahead for Giving Back program?
So we've
that
had
you
an
have in the
amazing journey so far because right in the beginning, in terms of our, I think in terms of our experience, our skill, our knowledge, our abilities, we were not as evolved as we are now, and it's been a good journey for us because it's very satisfying to be able to provide the best quality care. I think what I can very confidently now say that we provide world-class spine and brain surgical care to everyone, irrespective of their financial status. And that's very, very satisfying. And what to tell you what the road ahead is, I would like to just backtrack and tell you how the road so far has been.
Yeah.
So we started with very simple things like an X-ray machine in the operating room to help us navigate our way into the spine. And then in 2014, we took a huge step, which felt for us like it was a really huge step, and we invested in this surgical navigation system that would pair with the X-ray machine. So in traditional spine surgery, you have to keep bringing this X-ray machine over the patient, take X-rays in different positions. So it's very cumbersome. There's a lot of radiation exposure to the staff as well as to the patient, and it's very time consuming. And it also can increase the rate of infection, surgical infection. So in 14, we took this big decision to invest in the surgical navigation system. At that time, it cost us close to 1 crore of rupees.
Wow.
And but since the trust was there and the trust is tax exempt, so we managed to get some loans and we did that. So that made a huge difference to our surgical methodology.
Right.
And from then on, we evolved. So we did so many surgeries using that navigation system, and it was so much better, so much more satisfying. Much less radiation exposure, much less interference during the surgery from the X-ray machine. And we got a certain level of expertise with that. Unfortunately, we got hit by COVID. The whole world, 2 years was a total disaster. We really didn't get any inquiries for giving back that much. Right. Patients couldn't travel from their hometowns. So that was a bit of a setback. But it was always on my mind that, in spite of having the navigation system, we're still not really speaking world class.
Right.
So then the desire was to visit various places and see how they are doing their work. And the next step up, and almost like the holy grail of spine surgery, is O-arm navigation. Mm-hmm. So the O-arm is like a CT scan that can be done inside the operating room while the patient is under anesthesia. Mm-hmm. And that gives us anatomy of the spine in 3 planes. It gives us very, very, very accurate navigation ability during surgery. So we just got our O-arm.
Nice. So it's been quite a journey in terms of technological innovation that increases the efficiency of the whole process.
Absolutely.
Okay.
So many advantages to using the O-arm in the operating room. Of course, the level of anatomical detail we get is amazing. The anatomy is even more important when the spine is deformed and we don't know. Sometimes you can't really see because most of the procedures we do are minimally invasive. We're not really opening up the spine. You don't know sometimes where you are and if the vertebrae are rotated and so on. And it also reduces the amount of radiation. It reduces the amount of revision surgeries because you can scan the patient after you do your surgery to check that everything is okay, right there in the operating room. You don't have to take the patient out, get a scan done outside, and then bring the patient back in case you need to change something.
Right. Amazing. Yeah.
So it's tremendous. It's totally world class.
Nice.
I can definitely say that without an element of hesitation.
Excellent. So, as a part of this, the raising funds for giving back, we over the years we have done, many races
Right.
as part of giving back and bar collaboration. Bar here is Bangalore Amateur Racing.
Yeah.
So. We have done a few I remember a few time trials and all that, but last year when we started the duathlon, I think we have done duathlon, relay duathlon, individual duathlon, men and women, then
For ITT.
just ITT
And
for
just running.
cycling and
Yeah.
just running.
Yeah.
And the response has been tremendous. Over
Absolutely.
nearly 200 odd riders have riders and runners and triathletes have signed up and participated in the event. So we are going to conduct another one next month, which is I don't know when this will go out, but the date for that is May 22nd.
Yeah.
We invite all the listeners to sign up for that. If you are not in town and cannot participate, you can still contribute to the Giving Back program.
Yeah.
I will be sharing the link for the donation in the description of the show notes, so that you can go and contribute to the Giving Back program.
That would be amazing. Yeah.
Awesome. So, Doc, you yourself have gone through a couple of back surgeries, right?
Let's not put a number on that. Let's say I've gone through some surgery on my spine. Yeah.
Yes, on your spine, right? What has been your experience on either side of the tables?
I think it's very rare for you, for a person. Sometimes very few doctors get that experience of being on both sides of the operating knife, so to speak,
Right.
or the surgical scalpel, and it gave me a lot of insight into what our patients actually go through, and that makes empathy a very natural thing. Because when you see a patient in pain, then you know exactly what they've been through. And when you see a patient who's about to undergo surgery, their anxiety levels, and then post-op, how they approach recovery, how I approach recovery, it's amazing. The insights that I can give them, I think, are very, very helpful to both myself as well as to them.
Right. Excellent. So, all the best for your recovery and strengthening as you go on. And
I'm very excited about the duathlon, and
Yes.
I hope we get a lot of participation. We also have some surprises coming
Yes.
up on social media, so watch out on our Instagram and Facebook pages.
Yes.
There are going to be some special prizes and some lucky draws for a few early bird registrations, and look forward to seeing everybody there on the 22nd of May.
Awesome. Thank you.
Thank you so much.
Hi, Bishen. Welcome to the Working Athlete podcast. It's a pleasure having you on the show.
Hi Venki, happy to be here.
Bishen, to start with, can we start with a brief introduction about yourself for the audience?
Sure. My name is Bishen Jaswant. I'm a lawyer. I work with the law firm Cyril Amarchand Mangaldas. Been with them for the last 5 years or so. Before that, I graduated as a lawyer in 2012, but I've done a non-law job in between as well. I did work in cricket for a couple of years in cricket statistics with ESPN. So you can say I dabble a bit in this and that. But yeah, for the last 6-7 years, I've been very much a full-time lawyer.
Okay. So have you been an athlete, because you mentioned cricket and statistician with ESPN for cricket. Have you been in sports all your life, or when did your sports journey start?
Always been crazy about sports. I think from school, have played in the school team in a number of sports, volleyball, cricket, football, and even now recreationally, I play on a weekly basis, squash a couple of times, badminton a couple of times, go for a run here and there, cricket, football on weekends. So sports is a big part of my life, fair to say, and I'm always doing something or the other. Only recreationally, nothing at a very professional level or anywhere close to it. But
Nice. I mean, but it is a gamut of sports. Sounds like cricket,
yeah.
squash, badminton, everything.
True.
Okay, that's very nice. So, how did uh, how did you start playing, or when did you start playing? And as you started working, how did sports and the various activities that you do help you with your work and stuff?
To start playing, I would say, I think my father would have had a fairly influential role in starting playing because he was also very much into sports. My name is Bishen Jaswant, named after a cricketer, Bishen Singh Bedi. And he enjoys cricket, tennis, football as well. And so I suppose that's how it started. And then as I kept playing when I was young, I enjoyed the competitive element of it, the feeling of winning, competing. I guess that's what really caught me, and therefore I began to play whatever sports I could play. After school, you don't think about which sport, you just play what you can, and then you start enjoying something more than the other. And then through school, college, in my work, how has sports helped me? Definitely, sports teaches you how to lose. Sure, it teaches you teamwork and all of that, being competitive, but it also teaches you how to lose, which means that in day-to-day life, you are able to overcome challenges a little bit more. You don't expect to have things handed to you on a platter all the time. You think it's okay to lose. You can come back and win later, which is how it is in sports. I think maybe that's the biggest takeaway for me from sport.
Yeah, that is very true. Very good takeaway. So, when did I understand that you had a back injury and you had to go through a back surgery, right?
Yeah.
So, how did the back injury happen, and how did you end up getting the surgery?
So, how the injury happened, the first time I felt it was after a long net session. A friend of mine and I were playing cricket in the net. It was just two of us, and I was bowling. And that day I bowled a lot. I bowled 10 overs straight, and there was no second bowler, and I was quite dead at the end of it. But when I was doing my warm down and recovering, I could feel that my right leg had gone a bit numb. But I get injured all the time. I'm quite prone to injury. So I didn't think much of it at the time, and I kind of ignored it. I even did a couple of 5-kilometer runs on a slightly numb leg, trying to run it off. But even after 10 days, my right leg was still a bit numb. And so then I went to the doctor to get it checked, and we found from an MRI that there is a dislocated spine. L5-S1, there was a dislocation, and I was told the only way to fix it is to do surgery if you want to live an active life. So that's how I discovered the injury. And what I understand is that the injury was aggravated by sport, but potentially genetic.
Okay.
Yeah.
So there was there a degeneration in the thing or dislocation?
It was a dislocation.
Okay.
L5 had popped out. I understand it was about a 30 to 50% dislocation of the L5, so it had to be set straight.
Okay. So and when they said that you know, if you have to continue leading an active lifestyle, you have to get surgery. How did it feel?
It's not my first big surgery. I had a shoulder reconstruction done about 5 years ago.
Okay.
When again I was playing cricket and my left hand, it literally popped out. I could feel the bones in my shoulder, and even then the option was either you live with a dislocated shoulder, you can do your day-to-day stuff, but if you want to play, you need to do the surgery. And I'm quite clear that I'll never be Sachin Tendulkar, but playing sport is important in my life, even if it is recreationally. So it was a straightforward option for me to do that surgery. And the same mentality applied to the spine surgery as well. It's clear I do want to play. And one of the doctors, in fact, who I had met before I met Dr. Arvind, I had met a few other doctors, one of whom said, you're a lawyer, know that you're not a sports person. So just live with your injury and be a lawyer. You don't try to be a sports person now. But I wasn't able to accept that. Fine, I'm a lawyer, but sports is an important part of my life. And I think Dr. Arvind got that. And then eventually that's why we did the surgery with Dr. Arvind.
Right. So how was the experience of the surgery and the recovery process after that?
So I don't know. I guess the surgery can be a little nerve-wracking because you think, what if I come out of the surgery worse? because I walked into the hospital and walked and left on a wheelchair, right? Because you can live with the spine issue. So you think, have I made the wrong decision in that I could come out worse? My numbness in my leg could become worse. Yes, sure, it's all a possibility. But in my mind, the alternative is knowing for certain that you can't play sport for the rest of your life. And so in my mind, it was a fairly easy choice between knowing 100% you can't play and having a reasonably good chance that you can. I thought you definitely take the chance that you can play sport. So while a bit nerve-wracking, the choice was fairly straightforward in my mind. And the recovery process, I know from someone who gets injured quite a lot that the physio that you do afterwards is important and you should not neglect it. So I think I did the physio religiously for 6 to 9 months post surgery, and then on a scaled down version for another 4 5 months. I was doing physio for about 15 months, 14 15 months post the surgery. But I believe I should keep doing it for the rest of my life. Dr. Arvind, who's my surgeon, also had a similar back surgery, and he continues doing physio even today.
Yes.
He goes to the same physiotherapist as I do. So maybe I have to do for the rest of my life, but that's a small price to pay for having full or almost full mobility back and being able to enjoy sport.
Right. So now, what? So compared to the activity before surgery to now, are there any differences, or are you able to get back to the full gamut of activities that you have been doing?
I'm back to the full gamut of activities. I am, like I said, playing squash, badminton, football, cricket, running. So I'm back to the full gamut. I'm enjoying it as much as I used to as well. Am I able to play them at 100% that I was able to before? Maybe not. I may possibly be only at 90%. A part of that may also be me hesitating to push myself to do 100, 105, 110%. So I may be taking it slightly easy, being a bit conservative about how much I push myself, but as long as I'm able to really play everything at the same, play all the sports I want to and enjoy it as much as I was before, I think it's okay. And as I keep playing and doing more physio and strengthening, I'm sure I'll get closer to 100%. So instead of going too hard early and re-injuring yourself, I'm just taking it slightly easy and not playing at 100%.
Awesome. Yeah, I think that being conservative and gradually, easing into it is very important. Making sure that you are not injuring yourself again. And like you said, the physio and strengthening overall becomes a part of life. And like sports has become a part of your life and it's become your lifestyle. I think the physio and strengthening also needs to be part of that.
Correct.
Excellent. So, coming to what is the takeaway from the whole experience of this process, being injured, being rehabilitated, being operated on and then rehab, and now being able to get back to activity. What is your experience and what is the takeaway from that?
I think one takeaway is to be as fit as you can. Not all injuries are a result of lack of fitness, but for example, my first shoulder surgery, I felt that if I wasn't as heavy as I was at that time, my shoulder may not have popped. And that was a trigger for me to start losing weight and getting fit. I was about 107 kilos at that time. I dropped down to 77, losing a full 30 kilos from then. So that was the first trigger to strengthen, stay strong and stay fit, which will prevent injury to a great extent. Despite all of that, injury can happen. For example, my spine injury subsequently was nothing to do with a lack of fitness. It was a genetic issue aggravated by sport. Now, too bad. When that happens, I think important is to have a positive attitude towards it. You can start feeling sorry and bad for yourself. Oh no, I'm going to be in recovery for a year. But the positive is you can still get back to playing with the right approach and physio and strengthening and all of that. So I think a positive attitude goes a long way in getting you out. I remember when I came out of the surgery, and this I would have been in under anesthesia at the time, the first thing I asked the doctor subconsciously was, when can I run my first 5K? And doctor being highly, supportive and encouraging at the time, said you can do it in a month. which I'm sure he knew was over optimistic, but he was being encouraging. But I did, hearing him say you can do it in a month, I knew it can't be too far off from that. So I did run my first 5K after a spine surgery in 2 months.
Nice.
A very slow 5K, but
Yeah.
I didn't stop. I ran the whole 5K. It took me 35 minutes or something, but I did run the full 5. And all of that comes from, I think, having a positive attitude towards the entire process.
Yeah.
Yeah, so I think
No, that is very good. You know, the fastest way to get, I heard somewhere that the fastest way to get where you want to go is slowly, right? You know, as long as you are making progress
yeah.
slowly in the right direction, I think you will get there. And like you said, staying positive and moving in the right direction, knowing that it is going to take time,
Yeah.
but eventually you are going to get back
there.
to it,
Yeah.
is very important. And thank you for sharing your experience
Pleasure,
with the Working
pleasure.
Athlete podcast. Hello, Dr. Raghavendra. Welcome to the Working Athlete podcast. Can we start by a little bit of introduction by you about yourself and then get into it?
Hello. I'm Dr. Ragavendra. I'm an orthopedic spine surgeon. I've been working with Dr. Arvind Bhateja for more than 12 years now. And I'm specialized in scoliosis surgery along with other things in spine. And we've been doing, good amount of work. And we have moved to Sparsh Infantry Road since close to 2 years now.
What is the process of this? How do you know that a person is will need surgery
Okay.
and will not be able to do without a surgery?
Without the surgery.
And then what are the steps in?
Yeah, see, that is actually the part of the training where we usually treat patients conservatively, that is without surgery, by either exercises, medications, physiotherapy, and all these things. We put them through a structured program, and once they have failed, most people do benefit from conservative treatment, that is without surgery. We can put a number as about 3/4 patients get better without surgery. But these 25% patients either fail the conservative treatment in the first place, or they come back with the problem after having benefited the first time round.
Right.
And then they can't keep going on like this, not being able to participate either in their work or any other profession that they're into. So they can't miss work constantly or regularly. So that is when we decide that, in consultation with the patient on what they are looking for, we decide for surgery. And especially there are some, maybe about 2 to 3% of patients who acutely need surgery,
Right.
where there is some neurological problem which can't wait. So in those cases, of course, we have to counsel them for surgery straight away. But majority of these patients, we do offer conservative treatment, and we are successful in that. In patients who fail conservative treatment, they come back for surgery.
Right.
So we do the evaluation, we do an X-ray, we do an MRI, we see what is the amount of pressure on the spinal cord, if at all the spinal cord or the nerve roots, if at all there is one, and then we take it from there.
Okay. So once a patient it is decided that he needs to undergo surgery, and then how long does it take for them to get back to their normal life?
Okay, it depends on the kind of surgery. So we do sometimes we do what are called as microdiscectomies, where they are back on their feet the same evening. Of course, may not be active, but then they can use the toilet, and then they can go home the very next day. There are other kind of surgeries which is called as fusion surgeries, which take a little bit more time, maybe 2 days or 3 days for them to get discharged. But all these patients are up and about in about 10 days, the shortest, which is microdiscectomy. Maybe in about 3 weeks' time, the fusion patients also get better, and then they can get back to work, provided it is not a heavy manual job.
Okay.
So they can get back to desk job. And of course, they do have to follow precautions like not bending, not lifting weights, driving, long distance driving has to be avoided. We do advise them how to go about, and then the plan is to get them back or put them back to where they came from or what they were actually doing,
Right.
rather than them quitting their job or not doing anything at all after surgery.
Right.
So those days are gone. People used to believe that once you get a back surgery or a spine surgery done, you can't get back to your regular work or you can't get back to your previous work. Today, more than 95% good results are there in discectomies. So we are able to actually put them back to where they started out from.
Right. So I just spoke to one of your patients where he is able to get back to playing cricket, running 5Ks and all that. So
Yes.
it is a testament to the kind of work that you
Yes.
guys, and Dr. Arvind do. So over the years, right, what kind of changed in the whole
Okay.
process, and what remained the same?
Okay. I would not be wrong if I tell that last 20 years, we have actually had a sea change in spine surgery. So what has happened is, because of technology, first we are able to diagnose the problems better. One. Second thing is, we are able to localize and pinpoint that this exactly is the cause of the problem. Because especially with better radiology, like we had the CT scan, but then MRI has really changed spine ailments evaluation that much. So we are able to pinpoint exactly where the problem is, and because of that, we can actually do a minimal work. That is, we can operate patients with a very small incision rather than opening up and making a large cut in the backs. So that puts them back to their work that much faster.
Right.
One. And along with that, we have had a lot of other advances. Even during surgery, we are able to now make better decisions as to, if at all we are putting screws into somebody's back, we are able to make better judgment as to the direction of the screw, the length of the screw, the thickness of the screw, which we are able to see live in the operation theater, rather than seeing it later or realizing that we have possibly put a shorter or a longer screw or a screw that is not in the right position. So tech has actually enabled us and made spine surgery that much, I should say, safer
And
to
precise.
just about and that much precise, because we do have very important structures in and around the spine. There are major blood vessels. There is the spinal cord itself. So the room for error is very minimal.
Right.
It's like a couple of millimeters on either side.
Right.
That has been now that much easier. It's that much easier with we have got actually navigation. We have got O-arm. And what has not changed is the clinical background. Like, we do have to see we have to first see the patient, understand their problems, do a thorough clinical examination, find out where the problem is and what the patient wants out of the treatment. That has not changed, and I hope it will not change, because in today's world with so much of artificial intelligence and so much of tech, we can't really lose the human touch.
Right.
So that needs to be there, and I really hope that doesn't change
Yeah.
in the decades to come.
Definitely. The human touch is very, very important,
Yeah.
right? And the care and the love, right?
Yes.
So, doctor, do you kind of have, over the years, you would have done so many surgeries, touched so many lives, and enabled so many people to get back to their lives, right? So do you remember what would be the most memorable case or patient?
There are several of them.
Yeah.
There are several of them, but then if I have to just two patients if I have to recall, one of them is now a doctor herself. So it was a patient of scoliosis which I corrected many years ago, And then she is now, I completed medical school and she herself is a doctor. She actually had come and met me a year or so. And then she keeps posting her pictures and all that. That is one thing.
Amazing.
And then, it is. And one more boy, again, a scoliosis. And there was actually, as I told you, screws can go wrong, can move during the surgery. So this boy actually came back to me maybe 2-3 months after surgery, and the screw then we found out was not exactly in the right position. And immediately the patient's family, we counseled them. They were ready to undergo the surgery again. We had to replace the screw. And immediately after the surgery, I came and spoke to him. He said he is 85% to 90% better immediately post recovery.
Right.
So it is not that things don't go wrong, but then we should have the technical know-how to make sure that even things do go wrong, we should be able to actually correct it. Of course, within a reasonable period of time.
Right.
So both are important.
Yeah.
So we should be able to actually make sure that things that might have gone wrong can be corrected.
Right.
So that amount of in-depth knowledge and skill, and of course aided by relevant technology, is important.
Very good, doctor. So thank you for taking the time and sharing your experience and the kind of experience of the patients that you have treated with the Working Athlete podcast.
Yeah. Thank you, Venki.
That was about giving back and spine surgeries. It is a very good cause. If you are willing to contribute towards this charitable cause, you can see the links for making the donation in the show notes. Please consider making a contribution towards that. Also, if you are enjoying these podcasts and are finding them useful, please make sure you subscribe to the channel on YouTube as well as on your favorite podcasting app. It is a cost-free way of supporting the work that I do with these podcasts. Thanks again for your continuous support. See you next week with another episode.